Hey, this is Dr. Tom Rogers. We're talking today to a special guest. I'm really excited about this. I've been kind of waiting on this interview and talk for about a month now because if you'll realize, last year I turned 65 and got on Medicare. So we're going to talk today about kind of like the business of medicine. I love talking about the business of medicine because medicine is a business. Whether you like it or not, it is a business. And with our current climate, who knows what's going to happen in the next few years. But one thing I can tell you, I will keep you updated because I'm in on this. I know the knowledge. I know what to do. And now I'm a part of it. I'm on Medicare. Who would have thought? But so last year, in preparing, I didn't realize that Medicare was so complex. There's so many decisions to make that can affect how much you pay and the services that you get. I mean, think about it. You've been paying all your life into this Medicare fund, and finally you get there, and it's so complex now that you better know what you're doing. You'll get screwed. So I queried all the experts that I knew, and I came up with one name that kept coming to me around and around again, and it was Renee Thompson, who's sitting here to my right. She guided me last year through Medicare, the Medicare Haze, what I call it, and it's been great. Really changed my mind about a lot of things and got me in on a special plan that you probably have never even heard about. Mine is called Plan G. But anyway, we'll talk about that in a second. It's great to have you back after 1 year, Renee. I can tell you my experience with Medicare in the past year. I've had a few things, a couple little visits, very few medications I've had to get. I did have to have an MRI of my back, which was covered by my plan. And the only problem, knock on wood, that I've had is a couple back problems this year, which we'll talk about in another episode about how bad backs are as you get older. But in any event, it's great to have you here, Renee, and I want to get an update on what's happened in the last year, and kind of maybe you can guide our audience through this purple haze of signing up for Medicare, because if you're around my age or a little bit younger, you're getting bombarded with people trying to get you to sign up for their Medicare plan. And before I heard about you, I probably would have done the typical thing, listened to my TV and signed up. Yeah, all this is covered. Okay, I want it all. I'll sign it up. But then I learned a little bit on the deeper level, some things they don't tell you about. So talk to me about, I don't want to talk about specific plans, but I want to talk about the various options that you can get. More specifically, I had Plan G, which you're not going to hear about. And that's what fascinated me, is because nobody's really going to tell you about Plan G unless they're more of an independent person like Renee Thompson. So, who I've referred many patients to, including family members. But give me kind of an update about Medicare and the options, the in and outs, who might want to choose one plan over another, how much it's going to cost them, things to watch out for.
Okay, so typically you want to talk to a broker, someone who doesn't just represent one company. You want someone who's willing to sit down with you and explain Medicare as a whole, what it covers, what it doesn't, and then what your options are outside of original Medicare. And there's a gamut of things out there, and advantage plans, supplemental plans, drug plans, but you want someone that will sit down with you and kind of help you work through that maze. Because depending on your health issues and things that you have going on, one plan might work better for you than another, but everybody is very different. It's not a cookie cutter anything. So just because your third cousin removed has a specific plan doesn't mean that's going to be the best plan for you. So you need someone who can sit down and just basically show you what's out there and educate you on what you may or may not need.
So it's going to be different for everybody depending on your state of health, how many medications you may be taking, and that's another podcast I'm going to do is medications and getting your scripts filled, because what I've found out for the past several years is if you pay cash and use GoodRx, you can get your medicines probably a lot cheaper than even if you use your insurance. That's the thing that's really fascinated me through the years. But yeah, so you'll sit down and talk to the patient about what kind of medical problems they have, how many medicines they're on, how many times they see the doctor in a particular year, how many x-rays they may be getting, can they expect to go on the hospital, that type of thing. Because once you turn 65, you're going to have more medical problems, I guess, than when you're 30. Hopefully, my job's to reverse that to where you don't have problems, and I think you can do that. But everybody needs medical coverage, in my opinion. So even if it's just for disaster, really, I think to me, that's what insurance is for, disaster. That's why they call it insurance. It's not for every cold that you get, and just I think that's what screwed up medicine really, is people expecting their insurance to cover everything. I mean, we have a major insurance problem as well as a health problem like obesity and drug addiction. We have an insurance problem, in my opinion, that people just expect everything, and then they expect everything to be covered. And in the meantime, what that does to physicians and hospitals, it just overwhelms them, drives the cost up, and you have a lot of middlemen getting part of the money. So it's a complex thing. It's nothing like it was when my dad was a physician many years ago. But we're here, so we gotta navigate it, and that's why you're here to help us. I love the fact that you're an independent broker, so you can give me what you did, a totally unbiased opinion on what I needed. Not, you weren't trying to sell me something because you got more of a commission on it or something. So that's what I really admire about you and why I tell everybody about you. But anyway, so through my own experience, the reason I got Plan G, which I like to talk about specifically, it may not be for everybody, but the reason I got it is because I realized that Medicare, if you sign up for an Advantage plan, and I'm not going to mention names, we don't want to do that, but say I signed up for one of those and I came down with some weird disease that they couldn't handle around here, and I needed to go to Vanderbilt. And Vanderbilt doesn't take that plan, so I can't go there.
That's correct. So if you do, and there's some Advantage plans that have a PPO attached, which means you can go out of the network. You're just going to pay more out of your pocket, not 100%, but more, as opposed to supplementals like a G that, as long as the physician or group takes original Medicare, they, by law, have to take a supplemental plan. So if you want to go to Vanderbilt and Vanderbilt takes Medicare, then they're going to take your supplemental plan.
Okay. Which I like. Say I was traveling. I travel quite a bit, and I was in California, and I happened to have to go to the hospital, and one of the hospitalists or ER docs that happened to see me was not signed up with that particular Advantage plan out of Tennessee. What would happen?
If it's not deemed an emergency, then you're probably going to pay the cost out of your pocket. Most of your Advantage plans do have an emergent care that if it's an emergency like a heart attack or something emergent, then they will cover it. But if you just have a cold or the flu or something, typically they won't cover that.
That can get kind of complex, can't it? Then when the bills start rolling in, you're not sure what you have to pay and what you don't. The reason I like my plan that you set me up with is because anybody that takes Medicare has to take me, whether I'm traveling or I need a referral to a big tertiary care center. And also the fact I like my plan is because the fact that if I'm hospitalized, I think I have a $190 deductible for everything. Correct me if I'm wrong, but when I'm hospitalized, 100% of it's covered. On some of the other plans, maybe not.
And so even some of your supplementals, this is where you have to watch the G supplement, which what you have, yes, it will cover your hospital stay from day one. After, because Medicare doesn't cover the first, for 2020, it's $1,410. So it doesn't cover the first $1,400 to be hospitalized. Your supplement pays that.
Okay.
What your supplement doesn't pay is your Part B deductible, which for 2020 was $198.
I see. Okay. So you figured out for me, you talked to me, and I'm not on medications, and knock on wood, I'm pretty healthy, keep up with things. You figured it'd be better for me to get Plan G. And also, everybody needs a drug coverage, or you should have one. And I think my drug coverage was dirt cheap, wasn't it? $13 a month or something?
Yeah, so when you turn 65 and you're getting on Medicare, if you don't have credible coverage through an employer, you need a drug plan. Now, by law, you don't technically have to have a drug plan, but if you don't take one and several years from now you need a drug plan and then you have to pick up a drug plan, then you're going to get penalized 1% for every month you didn't have a drug plan back to when you turned 65 or took your Part B. So that can get costly if you don't go ahead and take one. So even if you're not on any medications, I recommend that people take a inexpensive drug plan. Now the Advantage plans, they do that is already that's most of those, it's already part of it.
Yeah.
But if you're going to do just original Medicare or Medicare and a supplement, you really need to take a drug plan.
Okay. And mine, I think, is $13 a month. So it's really nothing. So
and those change every year. So if let's say you're already on Medicare, whether you're Advantage or supplemental, you really need someone every couple of years to sit down with you and do a plan review to make sure because medications change. You might pick up a couple of new medicines, or your company may decide they're not going to cover that specific medication anymore. So all of that stuff changes every year. You really need someone to sit down with you every year or two and do a plan review.
So are you saying some of these drug plans may cover a really expensive medication where some of them don't?
Yes. So I will say, like, typically drug plans and or Advantage plans have to cover at least one medication in a therapeutic category. So if you need like a blood pressure pill or whatever, you just have to make sure that whatever that specific one is that your drug company or your Advantage plan is going to cover.
Okay.
But those drugs specifically will change year to year depending on what drug they will cover in their formulary.
Do you find that some cover better than others?
It depends on the specific medications that you take. It's depending on really what specific drug plan you will need or Advantage plan if you decide to go that road.
That can get complex for some folks, because some folks are on way too many medicines, in my opinion. The other thing I really didn't care about, I didn't care if dental or vision was covered for me, because knock on wood, I'm pretty good there. But some people may want to purchase dental or vision. Can they do that while still being on a Plan G?
Yes, there are several standalone vision and dental plans out there. And again, it's all in what your specific need is. This is why you need to sit down with someone and let them kind of go over what your specific needs are.
Okay. It's interesting. I was kind of surprised with how much Medicare in general cost if you still work. I mean, that's just another way our government kind of digs their pockets into people that make more money than other people, because Medicare, even though you pay into it all your life, when you reach 65, you think, "Oh, I'm finally covered. I'm going to be given insurance." Not the case at all, especially if you're working and make a pretty decent salary. You're going to pay a lot of money.
Yeah, so when you start taking your Medicare A and B, typically when you take that, you will pay a specific price for the Part B. It's $144.60 for most people, but then if you and or a spouse make more than a certain amount of money, they call it an IRMA, an income related monthly adjustment amount. So if you can go to Medicare.gov and look at that. It'll tell you the brackets as to income levels, as to if you're in this income level, then this is what you will pay with an IRMA for your Medicare Part B. And if you pay for an IRMA for your Part B, you will also pay one for your Part D.
I hate IRMA. You know, you think you wouldn't have to pay IRMA when you got 65, even though you choose to still work. I mean, in my mind, our government, I'm getting political, but our government they don't want you to work, I guess, after 65 because they hit you hard with everything after 65. I guess they just want you to retire. But now we're living longer. I have no intentions of ever retiring. You know, I just don't want to. Why would you? You know, if you're capable of helping people out and still staying active, I think you're healthier that way. But that's totally on a side note. That's just my own opinion. But I know many happily retired people, believe me, including a lot in my family. But anyway, so for people who are not sure, this may sound simple, but go over again what Part A, Part B, Part D. Tell me about the parts again.
Okay, so Part A is going to be hospital coverage. That is typically if you've paid into Medicare, 40 quarters, 40 weeks. There's some 10 years typically is when, as long as you've paid in 10 years, you don't pay for Part A. Okay. Part B is basically everything else medical that you would need to have done. And that is typically what costs the $144.60. That's the price for 2020. I think that's actually going to go up a little bit for next year. I'm just not exactly sure what that is. And then the Part D, you'll need a Part D regardless of whether for drugs. Okay. So your Medicare A and B, and then a drug plan if you're going to just do original Medicare, or if you're going to do supplemental to pick up the costs that Medicare doesn't cover. Or you can do Advantage plan, and those typically range from 0 premiums to about $100 premiums. You're going to pay co-pays. You'll pay co-insurance, which is typically a percentage, money out of your pocket until you get to a range of $3,200 to $6,700 for an out-of-pocket maximum. Then the company will pay 100%.
Good explanation. Do you think on the advertising they make that look better than it is? And they leave some of the parts out? Like they say 0, you're not going to pay anything, 0 deductible, 0 copay, everything covered. Isn't that a little misleading?
Misleading, I don't know if I would use that word, but I would say because the 0 premiums are not for everybody. Again, all that has to do with your specific needs. There are people out there who just, whether it's to any fault of their own or not, just cannot afford $100 a month or $120 or whatever for a supplemental. It's this is why we have options, because some people just can't afford a supplemental plan. Other people that don't take medications at all and aren't sick and don't have a lot of health issues, some people want to stay on that Advantage plan side because they don't want to pay $100 a month for something that they may not be using right now. So again, it's the flyers that come in the mail to you from the specific companies. They don't give you the ins and outs of it, but they're trying to sell you their specific plan. This is why it's important that you sit down with someone who doesn't just represent one company.
I like the way you explained that. But one other thing I want to emphasize is before you turn 65, you need to sign up for Part A, right? Because if you don't, you can be penalized. Is that right?
No, the Part A is pretty automatic, whether you sign up for it or not. So
it's Part B you have to sign up for it.
Unless you're still working and have coverage through your employer. So if you're going to still work and have the insurance offered to you through an employer, then no, you don't have to sign up for your Part B. But let's just say you're self-employed and you're on, let's just say, Medishare. Well, to Medicare standards, that's not credible coverage. So when you get ready to turn 65, you'll need to sign up for A and B.
That's what I was thinking about. Okay, I'll tell you. This just tells me you need to talk to somebody like Renee who really knows what to do, because it's very complex. So many ins and outs, and you could really. I mean, you need to sign up at the right times. You need to sign up for the right plan, or you could really jeopardize yourself way down the line, especially on that drug coverage, where they penalize you 10% a month until you sign up for it.
It's 1% for every month that you don't have a drug plan, and that's based on the national average, which is about $33 for a drug plan. So you would get penalized 33 to 35% per month you don't have a drug plan.
Okay, that's really interesting. What about folks that are on Medicaid as well?
So that's a different beast all on its own. If you have Medicare and Medicaid, there are things out there available to you that offers some extra benefits. And again, that's where sitting down with someone who can kind of go over all of that stuff with you and be a little more specific about things that would be beneficial for them.
Okay.
Yeah.
Well, it's going to be real interesting to see what happens, over the next few years with all our national health care plans. I mean, who knows what's going to happen with it? This thing has gotten so complex that I think that's why a lot of people just push for, socialized medicines, for lack of a better term. So who knows what's going to happen out there? Whatever happens, I know you do need some form of insurance coverage, but even more important, you need to start taking care of your health. We talk about that day in and day out. Stay healthy, and you don't have to worry too much. Just use insurance for disaster. But wow, we're gonna have to do this again every year, and we'll update things. We'll keep you informed, because this thing's going to change. I mean, one thing you can be certain of, it will change, and most likely about every year there'll be new or different nuances to it. So. We'll keep you informed. In the meantime, Renee Thompson, we're going to put your information on there, and for anybody that may want to talk to you, But
and you can also visit my website. It gives lots of those specifics at TIG323.com.
TIG323.com. Okay. Well, it's been a pleasurable experience here. I've learned a lot even today, and we'll talk again next year. Anybody has questions, please don't hesitate to contact Renee. And if we can help you out too and give you advice, I will, because I'm there. I've already been out for 1 year, and I'm still kicking. So we'll see you next week. Thank you.